Hold on, go.
Hi, my name's Alexis. I'm going to be doing my head to toe. This is my blank sheet. Okay guys, this is a take. Gonna be putting that over there. Now I'm going to start by knocking. Hi, my name's Alexis. I'm going to be your student nurse today. How are you?
I'm good. How are you?
I'm good. I'm just starting by sanitizing my hands.
You're a student from where?
Saginaw Valley.
Oh, okay.
Can you start by telling me your name and date of birth?
I'm Caitlin Duffing, and my birthday's July 19th, 2001.
Okay, great. Can you tell me where we are?
Michigan?
And then what year is it?
2022.
Great. Do you have any allergies that I should be aware of?
No allergies. Nope.
All right, perfect. So today we're going to be doing a head to toe, so a full assessment.
Okay.
Are you okay with that today?
Yeah, for sure.
All right, so before we start, we just have some background questions. Are you on any medications right now currently?
Just birth control.
Okay. Why did you start taking that?
For my acne.
Okay.
Mm-hmm.
Are you sexually active?
I am, yes.
Okay. And do you use another form of contraceptive against STDs and STIs?
Yeah, we use condoms.
Okay, great. With the birth control, have you noticed any side effects from it?
Nope, no side effects.
And how long have you been on it?
About 5 years.
Okay, great. And how are your periods on that? Are they regular?
Yeah, they're regular. They don't last very long, but they're every month.
Okay, and then when was your last period?
I'm on it right now.
Okay.
Mm-hmm.
Do you take any supplements?
Nope.
Anything over the counter?
Tylenol for pain.
Okay, so just like when you have cramps or something like that? Cool. Do you have any past diagnoses that I should be aware of?
Nope.
What about surgeries?
I had surgery on my finger, and I had laser surgery on my nose when I was little for a birthmark.
Okay, and both of those went good?
Yeah.
All right, great. How often do you smoke?
I don't smoke.
How often do you drink?
I'm not old enough. I don't drink.
Okay, and then how often do you use street drugs?
I don't.
Can you explain what your diet is like to me?
Yeah, I eat like 3 times a day when I have time for the most part. Usually have like a bagel in the morning and a salad for lunch, and then like chicken and rice or something for dinner.
Right, okay, and then what is your activity like?
I work out like every day.
Oh, awesome, cool.
Yeah.
And then what is your pain at today from a scale of 0 to 10?
None, I have no pain.
No pain, all right. So the first thing that I'm going to do is I'm going to grab a set of vitals from you.
Okay.
So yeah, just making sure that your legs are uncrossed. I'm just rolling up your gown right now so I can have your arm.
Ooh, the cup is cold.
I'm sorry. All right, moving this to the side. Putting it there. Okay, so for your blood pressure at about 110/74, would you say that that's normal for you?
Yeah, that's pretty normal.
All right, great. Well, we like to see that below 120/80, so everything is looking good there. Next, I'm just going to take your temperature. All right, 97.5, perfect. Now I'm going to take your pulse and your respirations.
Okay.
So I'm just gonna look at my watch here. I got a pulse of 72, which is good. We like to see that between 60 and 100, and then your respirations were 14, which is great. We like to see that between 12 and 20.
Okay.
Next, can I see your hands? Normally I would take your SpO2, but we don't have one of those today. So I'm just going to assess for any clubbing, which I don't see any, and then check capillary refill, which is less than 3 seconds. Check for clubbing again, which I don't see any of, and then check capillary refill again, and under 3 seconds, which is good. The next thing that we're going to do is inspect your arms. So I'm just going to move this up. First, I'm just going to inspect. I do see you have a tattoo here. Have you had any issues with that?
No, I've had it for like a year.
Okay. Just looking for any lesions or moles, anything to be concerned about. Next, I'm just going to feel up the arms for muscle tone and symmetry, and everything feels good there. Now I'm going to take your radial pulses at the same time. And those are symmetrical and bounding. And then moving on to the brachial. And those are symmetrical and bounding as well. The next thing that I'm going to have you do is just some range of motion tests.
Okay.
So can you go like this for me? No pain.
Mm-mm.
Roll out your hand. Can you squeeze my hands?
Sorry.
No, you're good. Just put your hands like this. Don't let me push in. Don't let me push out. And then like you're swimming. And then backwards. All right, that was just checking for crepitus, which I don't see any of. Any pain with any of those?
No.
All right, great. So the next thing that we're gonna do is check your cranial nerve number 11, which is your spinal accessory nerve.
Okay.
So if I could just have you shrug. Okay, great. So that was just testing the muscles in your back and your neck. So the next thing that we're gonna move on to is your head.
Okay.
Okay, so if I could just have you take your hair out for me again. Okay, so now I'm just feeling down your head. Any pain here?
Nope.
All right, I don't feel any bumps or anything. I'm just gonna look through your scalp. Look for any dryness or irritation, which I don't see any. And no itching lately.
Nope.
No like flakes.
Mm-mm.
All right, and I don't see any signs of lice, which is good. Okay. Now I'm just gonna reach behind your head and palpate your occipital lymph node. No pain there?
No.
Now doing your post-auricular behind the ear and your pre-auricular in front of the ear. No pain with that?
Nope.
All right, you can put your hair back up if you want to.
Okay.
The next thing that we are going to do is test 2 cranial nerves. First one we are going to test is cranial nerve number 7, which is your facial nerve. And that just tests for the muscles in your face. So I'm just gonna have you make a bunch of faces at me.
Okay.
So can you smile? Can you frown? Can you puff out your cheeks? Can you raise your eyebrows? Great. So your facial nerve is intact. The next nerve that I would like to test is cranial nerve number 5, which is your trigeminal nerve.
Okay.
So I am just going to have you bite down for me. Okay, and then I'm going to take this and just tell me where I'm touching on your face. Could you close your eyes for me?
Mm-hmm. Forehead. Left cheek. Chin. Right cheek.
Okay, so your cranial nerve number 5 is good, intact, and working. So before I even start with the eyes, I'm just looking at inspecting. I don't see anything. How is your vision?
It's good.
Okay. Do you have any drainage or irritation with your eyes?
No.
Okay. So now I'm just going to pull, if you could look down, and then if you could look up. Okay, so your conjunctiva are pink. They're not red or irritated, anything like that. And your sclera looks white. Lens is clear, not cloudy at all. The next thing that I'm going to do is test your pupillary reaction or constriction with direct to consensual.
Okay.
So just going to be shining in one eye, seeing if it contracts, shining in the other eye, see if it contracts, and that's direct. And then with consensual, I'm shining in one eye and looking at the other. Okay, and both of those look good. While I have you here, I'm going to test your corneal light reflex. So that's just how the light reflects off of your cornea.
Okay.
So, okay, looks good there. Don't want to blind you. Next test is for accommodation.
Okay.
So if you could just stare at my pen, and then at the wall behind me, not at the pen, And then at the wall behind me. Okay, great. So that is noting perla, which means that your pupils are equal, round, reactive to light, and they accommodate with distance.
Okay.
Next test is going to be testing 3 cranial nerves, your cranial nerves 3, 4, and 6, which is your ocular motor, your trochlear, and your abducens. So I'm just going to have you stare at this pen without moving your head. Okay, and all of those seem to be working good. So 3, 4, and 6 cranial nerves are all working good. Next, if you could just touch your nose and then touch my pen. To your nose, to my pen. To your nose, to my pen. All right, great. And then if you could make an okay sign, and then like you're playing an instrument, just move in between your fingers.
Clearly, you can see I've never played an instrument.
Okay, and then put your hands on your lap, and then flip them back and forth. All right, so that was testing your cerebellar function, which seems to be good and intact. Next thing that we're going to look at is your nose. Have you had any allergies recently? Any drainage, stuffiness, something like that?
Nope.
All right, great. So if you could just tilt your head back for me. Okay, great. I am seeing pink and moist nasal mucosa, and there are no polyps, no deviated septums. So how is your sense of smell?
It's good. It works.
Okay, great. So I'm just gonna have you close your eyes and sniff this.
Okay. Cinnamon.
Okay, great. So your sense of smell works perfect. That is olfactory nerve 1, or your cranial nerve 1, your olfactory nerve. So that's working good. Next, I'm just gonna palpate some sinuses.
Okay.
I'm gonna palpate your maxillary first. No pain with that.
Nope.
And then I'll do the frontal. No pain with that at all.
No.
All right. Now we're moving on to your mouth. Do you have all of your own teeth?
Yeah, I do.
How often do you see the dentist?
Twice a year.
Okay, great. Do you have a retainer?
I have a permanent one that's like on the top, and then one that I sleep with.
Okay, great. And then do you still have your tonsils, or did you get them removed?
I still have them.
Perfect. Okay. So now we are going to be doing some tests. The first one, if I could just have you stick your tongue out and move it side to side. All right, great. That was testing cranial nerve number 12, which is your glossopharyngeal nerve.
Okay.
Or cranial nerve 12, which is your hypoglossal nerve.
Oh, okay.
And that's testing the muscles in your tongue. Now we're doing the glossopharyngeal nerve.
Okay.
So I'm just gonna put this on your tongue depressor, and then if you just say ah. Okay, perfect. And then if you could just lift up your tongue so I can see your soft palate. Great. So when I made you say ah, that was testing cranial nerve number 9, which is your glossopharyngeal. That's testing for your phonation, so that you can speak.
Okay.
And then the last test that I have for your mouth is, if you could just swallow for me. All right, and that was testing cranial nerve number 10, which is your vagus nerve.
Oh, okay.
So you're not having any issues with your mouth recently?
No.
Okay, perfect. The next one is we are moving on to the ears.
Okay.
So I do see that you have some piercings.
Mm-hmm.
Any issues with those ever?
No.
All right, so I'm going to palpate at the pinna, work my way down, and then look behind the ear. Everything looks good there. And then palpate at the pinna, work my way down, and then look behind the ear. No issues?
No issues.
You have pretty good hearing, you would say?
Yeah.
All right, perfect. Now we're gonna move on to your neck. I'm gonna start by palpating the rest of your lymph nodes.
Okay.
So we're gonna start with your submandibular right here. And then the submental underneath the chin. Going to your cervical chain. And then if you could stroke up for me, doing your supraclavicular. All right, and then I'm just gonna test your tissue turgor on your clavicle right here.
Oh, okay.
So I'm just gonna pinch, shouldn't hurt. And it goes right back down, no tenting, which means that you are hydrated. So everything looks good there. Any pain when I was palpating those or no?
No pain.
All right, next I'm going to palpate your carotid pulses.
Okay.
One at a time so that you don't pass out. So I'm starting on this side. Seems strong. Going to the other side. And that seems strong as well. Next thing that I'm going to do is I'm going to use my stethoscope with the bell and listen to your carotid arteries for any bruits. Okay, so now that I got it on the bell, and then if you could just hold your breath when I do this.
Oh, okay.
All right, you can breathe. everything sounds good there. We don't want to hear any whooshes. That would be indicative of brulee, but I don't hear anything, so everything seems healthy.
Awesome.
Next thing I'm going to do is inspect your back. So if I could just have you come closer to the end of the bed for me. That was close. All right. So first thing that I'm going to do is I'm going to palpate your thyroid. So don't be alarmed. I'm reaching around your neck. Just feeling everything feels good. Next, I'm just inspecting your back, looking for any moles or lesions, something to be concerned about. But I do not see anything. Next, checking your spine alignment, which is good, straight. Everything's good. Now I'm going to percuss in 12 different spots on your lungs. Actually, first, I forgot, I have to do your chest expansion and your 2-to-1 ratio.
Okay.
So if you could just breathe deep for me. All right, chest expansion is equal on that side. And then if I could just do, putting my hands right here at your sides and then at your front, which means that you have a 2-to-1 ratio, not a 1-to-1, which would be indicative of COPD or barrel chestedness.
Okay.
Now I'm going to percuss 12 different spots on your lungs.
Okay.
Starting up here. And I am noting resonance. I'm just going under your broad here. Maybe 2 more. All right. Heard resonance when I was percussing, so now I'm going to auscultate and listen, hoping for clear lungs, listening with my diaphragm. All right, and then if at any point you need a break from this, just tell me. Just take deep breaths. All right, and last 2. All right, you feeling all right after that?
Yep.
All right, then I'm just gonna have you lay down for me so that we can do a cardiac assessment. All right, and are you fine with me undraping you for?
Yeah.
All right, perfect. So first thing that we're gonna do is assess for JVD. So if you could just turn your head that way, don't see anything, and then towards me, don't see anything on that side. So perfect. Now we can get started with the heart assessment. So I am going to be listening with my diaphragm and my bell. I'm going to be listening with my bell for murmurs. All right. So first place that we're going to start is your aortic, which is on your left side, or on your right side, 2 intercostal spaces down. So 1, 2, but right there. Listening with my bell, or my diaphragm first. Okay, and then putting my finger there, flipping it over to the bell. All right, perfect. Now, going to your left side, I'm going 2 intercostal spaces down to your pulmonic. So 1, 2, but right there. I've already flipped to my diaphragm. Okay, and then just flipping that around. All right, great. So flipping it back around to my diaphragm. I'm at the second intercostal space right now, or the pulmonic. If I go one down, second, third, right about there is going to be the herbs. I've already flipped it to the diaphragm. Putting my finger there, flipping it around, listening with the bell. Okay, perfect. So I'm at the third intercostal space right here. So if I go one down, sorry, going underneath your brow, right about here is going to be your tricuspid. So I've already flipped it to the diaphragm. Just gonna take the gown down a little bit more, put it underneath your bra. Great. Hearing that lub dub, which is what we want to hear, no extra sounds. Keeping my finger there. I'm gonna move to the bell. All right, perfect. And then I'm going to move one space down from your fourth intercostal space, which is your tricuspid, to your fifth, right here, which is your mitral. So I'm gonna flip this around to the diaphragm. And I'm going to count this for a full minute to get your apical pulse. Okay, so I got an apical pulse of 72, which is normal. All right, now for privacy, we can put this back up. And now we're gonna move on to an abdominal assessment. So I'm just gonna lift this up. First thing I'm going to do is just inspect. So I'm getting down at eye level, making sure that there's no bumps or lesions to be concerned about. I do see that you have a piercing. Have you ever had any issues with that?
No, I did pass out when I got it though.
You pass out a lot apparently when you get tattoos or piercings. But after inspecting, I don't see anything that's wrong, so I'm going to auscultate for bowel sounds. With this, I am using my diaphragm, and I'm starting the right lower quadrant, listening for 5 gurgles. Moving to the right upper quadrant. And then to the left upper quadrant. And then the left lower quadrant. Okay, perfect. Have you eaten recently?
Yeah, I just ate about a couple hours ago.
Okay, great. So I heard a lot of sounds. It seems like they were hyperactive. I want to make sure. Next, I'm going to be listening to the arteries in your stomach. I'm going to be doing this with a bell. I'm assessing for bruits again. So first, I'm assessing the aortic. Next, I'm moving to the renal, just 2 spots. Then I'm moving to the iliac, which also has 2 spots. All right, and then lastly, we're gonna do your femoral. So if you could just put your shorts up a little bit for me. All right. Sliding it in the side here. Not hearing anything. And then on the other side. Not hearing anything. So all those look good. Next thing I'm gonna do is percuss in the quadrants of your stomach or abdomen. I'm gonna start in your right lower quadrant, doing it a couple times in each quadrant, and I'm listening for timpani. Going to your right upper. Your left upper. And then your left lower. Okay, the next thing that we're gonna do is some palpation. Actually, wait, before we do palpation, I need to percuss up your abdomen towards your liver.
Okay.
So I'm gonna start down here. Okay, so right about here, it seems to get dull, so your liver is about right there. Now that we are done percussing, we are going to move on to palpation. I'm gonna start light, and then I'm gonna go deep, so just let me know if you have any pain. So starting with light. No pain at all?
No pain.
All right, I'm gonna go deeper now.
Still no pain.
Okay. All right, great. Well, your abdominal assessment seems good. Now we can move on to your legs. We can take this back down. All right. Yeah, so if you just uncross your legs for me. First thing that I'm gonna do is just feel for temperature. All right, and then I'm just inspecting for any lesions. It feels warm. I don't see any edema, so I would assume that it's all good. I'm going to take off your socks so that I can do some pulses. The first one, I know that we already listened to it with the bell, but I'm gonna palpate your femoral artery. I'm just gonna go underneath here. Okay, those seem strong and equal. Moving on to your popliteal. And those seem strong and equal as well. Moving on to your posterior tibialis. Those are good. And then your dorsalis pedis right at the top of your foot. And those are good too. I'm just gonna check your capillary refill. Well, your feet are pretty cold, but I still think that it's under 3 seconds, so we're still good. I'm just gonna have you do some range of motion tests now. So if you could just go up on my hands and then down like a gas pedal to the side and then in. Okay, great. So next test that we have is sharp and dull. So I'm gonna be using this fork and this is going to be sharp.
Okay.
That's gonna be dull. So I'm gonna touch different areas on your legs, and with your eyes closed, you're gonna tell me if it's sharp or dull and then where it is.
Okay.
Okay.
Sharp and my right thigh. Dull left thigh. Sharp left shin. Sharp right shin. Dull top of my left foot. Dull bottom of my left foot. Dull top of my right foot. And dull bottom of my right foot.
Okay, great. So, now that that's all good, are you feeling dizzy at all?
No.
All right, then I'm gonna have you sit up for me. All right, so here are your socks. You can put those on. I want to grab your shoes. you just scoot off the edge a little bit, but without your feet touching the ground. All right, so if you could just lift your legs up for me and then push them, like swing them out. All right, great. So that was just feeling for crepitus in your knees, and I don't feel any, so that's good. Next, I'm gonna use my stethoscope, the end of it, and I'm gonna check your patellar reflex. So I'm just gonna hit right here. Perfect. All right, a little less, but still perfect. All right, you said that you're not dizzy at all?
No dizziness.
All right, then I'm going to have you put on your shoes, please. All right, awesome. So when you're comfortable, I'm gonna have you stand up.
Okay.
All right, and so just close your eyes and put your hands to your side. Okay, great. That was the Romberg test. So that was just testing your balance, which is cranial nerve number 8, your acoustic nerve. The next thing that we're going to do, since I know that you have balance, is we are going to walk. So if you could just walk out with me. And then walk back heel to toe. All right, everything looks good there. You can sit down now. So I think that is the end of your assessment. From what I've seen today, all your cranial nerves are good and functioning, which means that your sensory perception is good. You have no friction or shear, no moisture that I see, no incontinence. You said that your diet was pretty good and your activities as well.
Mm-hmm.
So on the Braden scale, which assesses for risk of pressure ulcers, I would give you a 23 out of 23.
Perfect.
Yeah.
A student.
Do you have any questions?
No.
All right, I'm just going to check my sheet to make sure that I didn't miss anything. All right, I think that's it.